Well, the measles outbreak tied to Disneyland in California has spread to a sixth state, Arizona.
That's right. California health officials are suggesting people stay away from Disneyland if they have not been vaccinated against the virus. At least 70 people have been infected in the current outbreak. In rare cases, measles can be deadly. The latest case in Arizona involves a woman in her 50s who visited Disneyland in December.
Well, the last time we saw a surge of this virus was in 2014 with 644 cases reported in 27 states just last year, including Tennessee. Joining us this morning with more on this is Dr. Ryan Redman, an ER director at Children's Hospital, talking exactly what this means for our country and the people in it. Good morning.
Good morning.
Thanks for being here. We appreciate it.
Absolutely.
Let's talk first about what is measles and how do people get it?
So measles is what used to be a very common respiratory virus, which is passed by droplets, which is essentially coughing, sneezing, the same way that you catch kind of the common cold. Problem, of course, it can be much more severe than a common cold and can have cases that lead to even encephalitis, death, really bad health outcomes.
What are the signs and symptoms of the measles?
Originally, it starts usually with just cough, red eyes, a little bit of a runny nose. So at the onset, it is difficult to tell the difference between that and a cold. Now, as it progresses, you get a characteristic rash and some spots in your mouth that are pretty classic that usually help you tune into that. But part of the problem is we've got a generation of physicians who have really never seen measles, as it was declared essentially eradicated from the U.S. in 2000, has only started coming back since immunization rates have started to drop.
Talk about the immunization rates, because, you know, that's why it's coming back, is people aren't getting their children immunized.
Yes, and that's the most unfortunate part of this whole thing, is that this is something that is preventable. We've had really good public health success with in the past, but since those rates have dropped, we're starting to see comeback of this disease, and we fear other ones that can be easily prevented. Because you got to remember, immunizations work two ways. They work by protecting the individual, and then if enough people in the population get immunized, you get what is called herd immunity. That's what protects the most vulnerable people in our population, the youngest, the sickest, the immunosuppressed. And if your rates drop enough, that's what you lose, is that herd immunity effect.
This is such a big topic. We could talk about so many things right now, but are people who have been vaccinated at risk of getting the measles, or should they be okay?
Largely, they're okay. Now, we know with any vaccine, it's not 100%. Again, hence the importance of that herd immunity and not letting that disease kind of take hold in a population and have people that it can reside in and be transmitted to. So largely, if you're vaccinated, you are protected generally, and in the cases where you're not, the disease tends to be more mild.
So talk about the vaccine. When do you get it? And, you know, it's more than one shot, I guess.
Correct. It's a two-series vaccine that starts when you're about a year old. And again, for those kids who are under a year, this can be a very dangerous disease. And that's the importance. When we talk about vaccines, we always talk about it. We're all in this together, that eradicating these diseases is a community-wide public health exercise, not kind of the individual health preferences really need to be taken in light of what's good for the most vulnerable in our society.
Why have people been so shy of getting vaccines? What is this? What is the basis of it?
Well, this particular vaccine has been shied away from largely because of concerns about autism that were raised as a result of what's now found out to be really kind of fraudulent science that kind of took hold, and people had not seen these diseases for a while, so they figured it was not that big a deal. That, coupled with bad science, has led people to assume that it's safer to not get vaccinated for their individual children. We know that that's not true, and that's certainly not true from a public health perspective, but unfortunately it's become part of the narrative in the culture that we really have to start fighting against.
All right, very important information. Thank you so much, Dr. Redman, for being with us today from East Tennessee Children's Hospital.